Hi, I'm Dr. Amy Myers. I'm the founder and medical director of Austin Ultra Health, and today's video is going to be on food sensitivity testing. This is one of the functional medicine labs that I do in my clinic, and probably the second most popular test that I order. Now, let's just first start by what is a food sensitivity? Well, a food allergy and a food sensitivity or intolerance are two very different things. Food allergies are using our IgE mediated immune response. What do I mean by that? Well, let's just put it into some basic terms that I think everybody can understand. You eat a strawberry, you break out into hives. That's an immediate reaction, that's an IgE reaction. If you have one of those, you probably already know about it. An IgG reaction, on the other hand, is what's called a delayed food sensitivity or a delayed reaction in our immune system. It can take up to 72 hours to come out. So let's use an example there. You have migraine, headaches, and some digestive issues, and you eat whole wheat bread every morning for breakfast and some yogurt and a banana. You decide maybe something is bothering you from your breakfast and think, okay, well, why don't I not have the whole wheat toast this morning and see if I still have digestive issues and get a migraine headache that you've been getting every day. So on Tuesday morning, you wake up and you decide not to eat the whole wheat bread. You just have your yogurt and your banana. And later on in the day, you still get your migraine headache and you still have digestive issues. So you think to yourself, well, it's not the toast. I give up. Or perhaps you say, maybe it's the yogurt, and the next day you don't eat the yogurt. And you still have the headache and the digestive issues. Well, it could actually be that it is the bread, and that it's the bread from the 2 days prior that's still just coming out and causing the migraine headache and the digestive issues. So what we have you do in our clinic is go through the Myers Way, which is our food-based cleanse, and we have you get out the top inflammatory foods. And there's another video on this regarding exactly what we have you do. So we have you remove these top 12 most inflammatory foods, and we get them out of your system completely for a couple of weeks, and then we gradually have you add them back in. By really knowing your body and listening, and we of course guide you through this, you're able to determine if you actually have a food intolerance when you add these foods back in. And we separate it by enough days that it's not confused with any other food. So your body knows better than any test does, and that is our number one place to start, is by going through the Myers Way. However, a lot of people like additional information. They like to see the big red numbers on the test. And the food sensitivity test that we offer tests for 155 different foods. So as you can see, going through the Myers Way, we get the top 12 most inflammatory foods, but certainly there could be other foods there. So let me show you what the food sensitivity test looks like that we do here in our office. So this, let me cover up the name. So this is one of the food sensitivity tests that we do. I use a company called Immunolabs. I've personally found the best experience with them, and that is the most repeatable and reputable and gives us the best results. So I'm thinking this name is not fully covered here. So looking at here, what it does is, and you probably can't see this overly well, but it lists here the number of foods that this person's sensitive to, and it ranks them 1 through 4. And let me just look at this. So it gives a total of 27 foods. Now, that does not mean that this person can never eat these 27 foods again. What that means to me is that this person has a leaky gut. The more foods that are showing up here, the more likely that the person has a leaky gut. Now, again, I'll explain that in another video really about the leaky gut, but then the foods get ranked 1 through 4, 4 being the highest, 1 being the lowest. Now, sometimes that number does correlate with a person's symptoms, and sometimes it doesn't. Somebody can have a really, really strong reaction to a number 1 food. When we see lots of 1s and a couple of 4s, we tend to think that the number 1 foods, or the foods that only ranked a 1 as in stimulating your immune system, probably are really just a leaky gut. And what does that mean? Well, what it means is when I see gluten or dairy show up, I tend to believe that those are lifelong, and we guide you towards avoiding those foods for the rest of your life. And it is my belief, based on my knowledge and experience, that these are not foods that you recover from. These are, genetic, at least with the gluten, it's a genetic predisposition to have a sensitivity towards this food. And then in terms of the dairy with the gluten, the dairy can mimic gluten in the body, and our body thinks that it's gluten. So I tend to advise people to avoid those lifelong. However, if something like almonds shows up, for many people that's not an inflammatory food. So if an almond was a 1+ on your test, the way that I think about that, and you tell me that you love almonds and you eat them every single day, and you have a bag in your drawer at your desk at work, and that's really what you snack on 2 or 3 times a day, the likelihood is that your gut is leaky, probably from the gluten, and then because you're eating so many almonds, that it's stimulating your immune system. And so really we just need to back off the almonds, substitute that out with some other types of nuts, heal the gut. And again, you can see my information on my blog regarding how to heal the gut in our 4R program. And heal the gut, and then you should be able to come back to the almonds and in moderation, or come back to the almonds at some point. So the advantage of getting the food sensitivity test in conjunction with doing the Myers Way is that it's more information. It lets us know what other foods you may be sensitive to, either lifelong or more just because your gut's leaky, because you've eaten these foods frequently. We all have the habit. I do it myself. We find several foods that we really love. We find that they're convenient. We eat them over and over again. So in an ideal world where we're eating our foods, a different food every day and doing what's called a 4-day rotation. So on this test, again, it walks you through what foods you can't eat, the whole list of the foods that you can eat. My nutritionist, Brianne Herman, spends 50 minutes going over this at your follow-up visit. I know there are a lot of clinicians out there. I've seen patients coming in from other clinics where they get this test. They're told, don't eat these foods for 6 months, and then they can eat them, and here's your test, and that's it. This can be very, very overwhelming for people, particularly when we're dealing with children. We see a lot of children in my clinic, and this can be very, very overwhelming to parents to get these results. So we spend a lot of time working with you, guiding you, talking to you about how we're going to navigate this and what the process is going to be to add these foods back in, and when, and which ones we need to avoid for life, which ones for just a couple of months, and things like that. So this this is the 4-day rotation diet that they recommend. But also, in my clinic, I also do looking at dairy particularly, because that's a big problem for many people. And so I look to see if it's the cheese or casein part of the dairy or the whey milk part of the dairy that people are reacting to. This person's reacting to the whey portion. And then we also look specifically at gluten, because of course that is just such a biggie. And I do believe that this test, their guidelines are a little, or their limits are a little high. So, so we mark them down a little bit, but we go ahead and test you for gluten as well. So, that's the food sensitivity test that we do. How I think that it's different than, or our process is different than many, is that we do, again, have you go through the Myers Way. Your body knows better than any lab test. This test is looking at food intolerances or food sensitivities, not food allergies. This test, and again, we go over this test at your follow-up visit. We spend a lot of time with you. You can, schedule even more appointments if you need more guidance. Brianne walks you through the whole process. And then on top of that, we particularly look at gluten and dairy and see how those fit into the picture. So, if you have questions about food sensitivities, go ahead and post them below on the comment section. Love to answer your questions, and thanks so much for watching. I appreciate it.